My name is Dr. Lila Rosenthal. I'm a primary care physician, family medicine in Lafayette, Colorado. I just want to take care of patients. I don't want to care about where the money is coming from. When I have a patient who needs to see a particular specialist, I want to call and know that they'll be seen just because they need to be seen, but not, get told, yeah, we're not taking any new Medicaid this month, or we've reached our quota for new Medicaid this month. And these are real pushbacks that I get as a physician when I'm trying to refer a patient. And it's really, it's amazing that America has tolerated this type of two-tiered system, if you will. How long ago did we decide as a society that primary education was a universal right? But somehow we've decided that healthcare is held to a different standard. And I think we're better than that. I think we can agree that if education is a human right and voting is a human right, healthcare should be a human right too. Practicing medicine is hard. It's hard enough without all of the complexity in bureaucracy, in systems, having multiple insurance companies to have to deal with, multiple formularies, multiple claims denials, multiple ways that we get frustrated throughout the day with patients who think they have a product that we're in network with, and then they show up at the office and we figure out actually we're not in network, so now they have to pay out of pocket. That makes everyone frustrated. I would say not a day goes by that these issues don't come to the surface and derail my thought process, which really should be focused on helping the patient to feel better. An example today would be a patient who I had prescribed a medication for her about 6 weeks ago to help with her pain. She went to the pharmacy and was quoted a price of $75 for a month's supply. She presented this coupon card that I had given her, and that made the price come down to $22. And we're both thinking, why in America in 2017 should patients need to present a coupon card if their doctor even happened to give them that idea to be able to get their medication affordably? Crazy. I'd like to share a story that took place a couple months ago, but it really could happen on any given day. A dad brought his little girl in who I had been seeing for some time. For quite a while they had Medicaid because they were low income, and then the family's income rose enough that the child was eligible for the CHP Plus, the Children's Health Insurance Program. However, unbeknownst to the family, the child had been auto-enrolled into a Kaiser version of CHP. And not being part of the Kaiser insurance program, when they arrived and my front desk person saw the insurance card and saw that it was a Kaiser product, we were unable to see the child for a sick visit, and this created a very uncomfortable situation. On the one hand, we really wanted to provide care to our patient who we knew in the comfort of a place that they were familiar with for a sick visit. On the other hand, it was clear that the family would be responsible for the charges, or we would have to comp the visit. And these are choices that physicians should not have to make. The existence of these complex networks that are exclusive, that create closed systems and make it hard for patients to see who they want to see and who they need to see, is just creating unnecessary complexity and barriers to care. It's no secret that physicians are experiencing high rates of burnout. I saw a stat not long ago that something like 40% of pediatricians, when asked if they could afford to quit the practice of medicine, would they? That high of a rate said they would quit the practice of clinical medicine. I mean, this is just unacceptable because you work so hard for so long, you incur such debt, and really it should be joyful to give care to patients. And yes, there's always going to be difficulties with the job and complications that come up, but they shouldn't be of the bureaucratic variety that leave physicians feeling just exhausted and frustrated because of administrative hassle. It's unnecessary. It's stressing everybody out, and arguably toxic stress is at the source of what ails much of America today, patients and physicians. Can a child take advantage of a free public education if they don't feel well? How can a child have a chance at, success if mom and dad or other caregiver in the home is uninsured and unwell and can't access care? It's just amazing that we agree that, some people deserve access to care and others just have to pull themselves up by their bootstraps. I don't think it's in the interest of our society from a moral standpoint or a financial standpoint. When people are left uninsured or underinsured, that costs everybody. I grew up in the Midwest. I chose to go to medical school in Israel where there is universal coverage. And it was really shocking to come back and continue my training in Houston, Texas, at a county hospital that was really meant for the poor or uninsured. And it was extraordinary to see how people were treated at the county hospital compared to the private hospital across campus where you went if you had commercial insurance. It was like everybody just somehow accepted that this was okay, this was humane, and I thought to myself, they're doing a better job in Israel of taking care of their people than we're doing in America. I'd really like to help Americans believe that it doesn't have to be this way, that they can improve their access for less money and know that their neighbors and relatives all are in the same boat. I'd like to see every American have the same health insurance card in their wallet. How cool would it be if you got sick on vacation and you showed your card at the local hospital and they were able to pull up your record from another state because we were all on the same system? And you didn't have to worry about calling your insurance company to get permission to go to the ER because you were traveling and you needed permission. We don't have to tolerate this level of mediocrity in healthcare. And right now we seem to just have, decided that we can't do anything about it, but that's not the case. We have to come to see healthcare as a commonwealth, that what benefits one person will benefit everybody. There's just no reason to have exclusive networks. There's no reason that people should have to have narrow networks. Right now, narrow networks are a creation of insurance companies to pay lower rates to doctors and hospital systems in exchange for that narrow network. It's just a lot of game playing that benefits no one but the for-profit insurance company.